Welcome to the Dental Brief, the world's direct, right-to-the-point podcast produced to get you the information you need to learn and grow your practice. To learn more about our guests and find links to information discussed on our show, visit our website, dentalbrief.com. On to today's episode.
Hello, everyone. Welcome to another episode of the Dental Brief. This is going to be our last episode recording of 2021, and I'm excited to have with us to finish up the year. Elizabeth, Dewar, Anthony, say hello.
Hey, it's an honor to be here.
Glad to have you here, and I know you go by Beth. Mm-hmm. I'll just make that clear. Beth, why don't you tell us a little bit about yourself? Tell us how you got into dentistry.
Well, I got into dentistry by accident. I had graduated with a bachelor's degree in English with a minor in theater arts and was working at a Pier 1 Imports. And a nice man came through my line and bought this Charlie Chaplin poster that I admired. And I said, "Oh, I love that poster." He said, "I'm going to hang it in my office." I said, "Oh, you have an office? Would you like to give me a job?" And, I was just telling him about my phone skills were wonderful and everything. He said, "We are looking for a receptionist." So he gave me his card and I went for the interview and he hired me. He was a dentist. That is how I got into dentistry. I really honestly thought I was going to be a rock star or an actress. And there I was at Pier 1 Imports, and that's how I got into dentistry.
Fantastic. That's, I love asking that question because, there's so many times we hear, oh, my dad and my uncle and my grandmother and my cousin and whoever was a dentist, and we hear that type of thing. And then we hear these too. That's fantastic. So tell us, how did you get from that day to where you're at now?
So I went to dental hygiene school. I found out that we had a local program, and I went to dental hygiene school and graduated, and I started working in the office as a dental hygienist. And these were the same people I had known when I was working the desk. And
Sure.
Something I realized was sometimes people are kind of crabby, and I began to, and at first, I was a lot younger and I would, be nice on the outside, but be seething on the inside because I was, interpreting these people's behaviors as a personal assault on me.
Sure.
And sometimes people are actually like grabbing, hand grabbing and stuff like that. And I realized that, wow, well, people a lot of times will come into the dental setting kind of crabby. And what's up with that? And I became interested in that. At the same time, I was also on a personal journey of self-improvement, learning about stuff like trauma. And so I just kind of started to connect the dots, and things I learned about myself, I was able to apply to my patient interactions. And that's how I got started. But it was and I started that about 20 years ago. And I even wrote a book about it in 2013. And now I have to write another book because since then, when I became an orofacial myofunctional therapist, the pieces really fit together because I understood, oh my gosh, it's their airway. That's the trauma. I knew there was an initial trauma and that people were having a PTSD sort of experience. But I never could place the initial trauma. Now I know they're trying to breathe.
Yeah. So, I don't believe anyone ever gets to where they're at on their own, right? Good or bad. If somebody is, quote, a jerk, right? If they're just a jerk, they're a mean person or whatever. They didn't get there by themselves. They didn't just decide one day to be a jerk. Something in their life or something that happened to them or that's happening to them or whatever caused them or was part of helping them, get to where they're at. That doesn't mean people aren't responsible for their actions. They certainly are. So talk to me a little bit about how you help, right? Because what you're saying is that, these patients have issues that are going on. That it's not a personal vendetta against you or a dentist or whoever, but how do you heal? How do you deal with this? Like, how do you actually build that relationship and help that person not be a jerk?
Well, the first thing is it starts with me. Okay. I am in charge of my reaction to any situation. And the best thing I can do is to approach this person with as little judgment as possible and as much positivity as possible. I called my philosophy Serenity. It's a combination of serenity and dentistry. So I try to maintain a base level of serenity so that I can approach patients non-judgmentally. And, if they immediately present with, provocative behaviors, I have the choice to not react. And, but what I found is these patients that other providers complained about, when I approached them, I didn't have any problems. So I began to really recognize that how the patient is approached makes a huge difference in the whole interaction. And I learned to recognize signs of, patients that could possibly, be a challenge. And so I learned how to get myself calm. And I also learned to observe, not judge.
Sure. So give me a couple of tips. A patient comes in, they get in the chair, hygienist meets them, assistant meets them, and right from the start, they're just ornery, right? So
Right.
give me a couple of things that you can do to kind of disarm that situation and maybe turn it around quickly.
When you open the door to the reception room, okay, and the patient's sitting there, and if they're like this,
sure, arms crossed. Yep.
Okay, arms crossed, they're in a defensive mode.
Sure.
So I have to lower my voice. Hey, even if I'm having a terrible day. Hi, Mr. Jones, we're all ready for you. Come on back. Hey, how you doing? Come on back. A friendly greeting will automatically get things off to a better start.
Sure.
But, what happens is, professionals who will look out into the waiting room, see that the patient's defensive and react defensively to their defense.
Right.
And then it just goes down, down, down.
What if you have to have a hard conversation? What if you do everything you can to kill them with kindness, right? We all know that expression. And you're on your A game as far as how kindly you're treating someone, how compassionate. And it's just not going anywhere. And you got to get to a point where maybe you need to talk to the patient like, hey, you're not being so nice to us and we're here trying to help you. How do you, is that conversation something that you should do if obviously all else has failed?
Yes. And the best way to have that sort of a conversation is to sit down, get eye to eye with the patient, and lower your voice. When I bring down my vocal tone, the whole thing comes down.
Sure. Yep.
So I can sit and just, say what I observe. Gee, Mr. Jones, what I'm observing is that you're, that you're not having a good time, that you seem very upset. I'm always free to state what I see and how I feel about it. And then it's up to the patient.
Sure. Yeah. Now Beth, you work with dentists, right? You help. We do speaking, engagements, what have you. If you're in a practice and you just really struggle, and I think when we're honest with ourselves, right, as a dental community, there's a lot that are struggling with, hey, they just can't deal with one more angry patient. And just have it up here. I see this online a lot. Like, how should I expel this patient? Right?
Yeah, get rid of them. But the thing is, they're going to go someplace else, and that someplace else might be you. So,
it's just going to become someone else's problem. And some days that problem is going to become your problem.
Right.
And on and on. You're right. It becomes kind of like a risk pool of expelled patients. Who's going to get them next, right?
Right. And these people have, what I try to remember is I always try to remind myself that, Mr. Jones isn't a jerk. Mr. Jones is fearful presenting as hostile. Fearful presenting as belligerent. Hostility and belligerence and those sorts of things are almost always a front for fear. And the fear comes from their airway. So patients who refuse x-rays and those sorts of things, if you look in their mouth, they have huge tori. Look at their last set of bite wings. If they can't close their mouth on a set of bite wings, that's a good indication to me that, okay, this is going to be a challenge. And personally, my personal philosophy is patient autonomy. And if a patient, and I hear people complaining about patients dictating treatment, but the patient is in charge. The patient is the one who, it's the first ethical principle, patient autonomy. It's the patient's decision what happens to them, not mine.
I think anywhere in healthcare, people should want the patients to be in charge. Like they literally should want the patient making decisions and being active and engaging in that. It doesn't mean that the patient shouldn't be. You want patients that are smart enough to know that who the expert in the room is. But I believe that so hardly. I think if people aren't making decisions about their own health, they're not healthy.
Well, and so what are these? So these non-compliant, a patient who refuses. So we take a set of bite wings every year because the insurance covers them.
Sure.
So it's become, we just do it because that's how we've always done it. And 90% of patients are going to just go along with it because that's what we do. But really, what's that about? And patients who, refuse x-rays and then they get, and the provider gets angry and offended. Why? That's their right. You got to get that supervised neglect. You got to get that patient out of there. I personally think that supervised neglect is a phrase that was coined by litigation, by lawyers, and people who have a vested interest in keeping dentists afraid.
That's right. Yeah. You certainly, as a dentist, you wouldn't go see your family physician. And if your family's physician said you could do this, this, and this, and, you say no to them, if they responded that way to you, you'd be appalled by it. Yeah, absolutely makes sense. So let's say, Beth, in your travels and your experience, if a practice is looking for someone to help them with these types of issues with patients, how would they go about? What do you think is the best way to vet an expert and find someone to work with them to help with them?
I don't know that there are a lot of people who would go to an office and train an office in this sort of thing. I would imagine that the person, you would hire this consultant to come. They would come to the office and just get everybody together. And the very first thing, it would be to let's everybody just calm down. Let's everybody just, and, and then, lay out the information. These patients, here's how the airway works. Here's when you have a patient who's a mouth breather and you're trying to put something in their mouth, it's a reflex. Their tongue is coming up reflexively. They're not trying to do it to make your job harder. And, just so, something like that. But I don't know that there's, maybe I should start doing that. Maybe. I write about it and I talk about it, but I've never really considered, offering that sort of a service. It's interesting. Yeah.
So maybe something you should consider. Beth, I wanted to thank you. I know our time's short here. I wanted to thank you so much for coming on today.
Sure.
I think our audience can certainly take away some things that help, and I think some great practical information. I appreciate it.
Absolutely.
Beth, come back anytime.
Sure.
Thank you for joining us on today's episode. Did you know you can weigh in on today's topic on Facebook? Search The Dental Brief on Facebook or visit our website, dentalbrief.com, and just follow the link. We look forward to having you join us again on another episode of The Dental Brief.